Hi everyone, welcome to ACE Anatomy. I'm Dr. Divya. The base of the skull might look like a bony fortress, but it is full of tiny openings called foramina. Think of the base of your skull as a high security airport. Every nerve and blood vessel has a designated gate or the foramen to pass through. But what goes where and why does it actually matter? Stay tuned as we explore the skull's most important foramina, making anatomy simple, engaging, and clinically relevant. So let's dive in. In today's video, we shall look at some of the foramina in the base of the skull. The incisive fossa is present anteriorly in the median plane of the hard palate. The incisive foramen, right and left, they pierce the corresponding side, and each incisive foramen is traversed by the nasopalatine nerve, the posterior septal branches of sphenopalatine artery, and the greater palatine vessels. You can remember the mnemonic nasal palate goes in. So nasopalatine, the posterior septal branches of sphenopalatine artery, and the greater palatine vessels which go through the incisive fossa. The greater palatine foramen is present behind the lateral part of palato-maxillary suture. Greater palatine vessels and nerves, they pass through it. So you can remember the mnemonic grandma packs nachos. So greater palatine nerves and vessels. There are about 1 to 3 foramina in the pyramidal process of palatine bone, which are known as the lesser palatine foramina, and they are located just behind the greater palatine foramen on each side. The lesser palatine nerve and vessels, they pass through this foramina. You can remember little people nap. Little for lesser, the palatine nerves and vessels. The vomerovaginal canal is formed between the lateral border of each ala of the vomer and the vaginal process of the medial pterygoid plate. So it transmits the branches of pharyngeal nerve and vessels. You can remember the mnemonic people need vitamins. P from the people is for pharyngeal, N nerve, and vitamins V is for the vessels. The palato-vaginal canal is a canal between the vaginal process of medial pterygoid plate and the sphenoidal process of the palatine bone. This canal leads anteriorly into posterior wall of pterygopalatine fossa. It transmits the pharyngeal branches of pterygopalatine ganglion, the pharyngeal branch of maxillary artery, and the pharyngeal vein. You can remember the mnemonic play art video now. P for the pharyngeal branches, A is the artery, pharyngeal branch of maxillary artery, V is the pharyngeal vein, and N is the nerves arising from the pterygopalatine ganglion. The foramen ovale is an oval-shaped foramen in the greater wing of the sphenoid bone. It transmits the mandibular nerve, accessory meningeal artery, lesser petrosal nerve, and emissary vein. To remember, you can say ovale makes a large exit. The foramen spinosum is situated near the spine of the sphenoid and posterolateral to the foramen ovale. It transmits the middle meningeal artery, parietal trunk of middle meningeal vein, and meningeal branch of mandibular nerve, which is also known as the nervus spinosus. You can remember the mnemonic many men munch. The foramen lacerum is located between the sphenoid and the apex of petrous temporal bone. It is called lacerum because of the irregular margin. The carotid canal as well as the pterygoid canal, they open into this foramen. Only two structures pass through it. One is the meningeal branch of ascending pharyngeal artery, another one is the emissary vein. The internal carotid artery, it traverses its upper part with its sympathetic and venous plexus, that is, you see it within the cranial cavity. And the nerve of the pterygoid canal is also formed in its upper part. So to remember, we can remember the mnemonic I need exit. Basically, which stands for the important structures in relation to the foramen lacerum. That is, I is for the internal carotid artery, L nerve of the pterygoid canal, and E is the emissary vein. The carotid canal is located just behind the quadrilateral area of the petrous part of temporal bone. It transmits the internal carotid artery with its periarterial sympathetic plexus. So to remember, the mnemonic is intense pressure. Intense, it is for the internal, and pressure, periarterial sympathetic plexus. The petrotympanic fissure is located at the junction of the squamous and the tympanic part of the temporal bones. So here the cauda tympani nerve, the anterior tympanic artery, and the anterior ligament of malleus pass through. So to remember, you can remember the mnemonic cauda ties ans. The stylomastoid foramen is situated between the styloid process and the mastoid process. The facial nerve and the stylomastoid artery pass through this foramen. To remember funny smile. The jugular foramen is an interosseous foramen situated between the anterior margin of the jugular process of occipital bone and the posterior margin of the petrous part of temporal bone at the petro-occipital suture. It is divided into three parts: anterior, middle and posterior parts. So the structures passing through the anterior part are inferior petrosal sinus, meningeal branch of ascending pharyngeal artery, and in the middle part we have the 9th, 10th and 11th cranial nerves, and in the posterior part the sigmoid sinus, the meningeal branch of occipital artery. So to remember the most important structures passing through it, you can remember the mnemonic I go vagus again. So it is for the inferior petrosal sinus, we have the glossopharyngeal, vagus and the accessory nerve. I can also be for the sigmoid sinus, which continues as the internal jugular vein. The condylar canal is present in the condylar fossa just behind the occipital condyle. So it transmits the emissary vein from the sigmoid sinus. To remember, you can remember the mnemonic very cool vein, condylar and emissary vein. The hypoglossal canal is situated lateral to the anterior part of the occipital condyle. It transmits the hypoglossal nerve, the meningeal branch of ascending pharyngeal artery and the emissary vein from the basilar venous plexus. To remember, you can remember the mnemonic huge tongue because the hypoglossal nerve supplies the muscles of the tongue. The foramen magnum is the largest foramen in the skull. It is oval in shape and it is the communication between the cranial cavity and the vertebral canal. The anterior atlanto-occipital membrane is attached to its anterior margin and the posterior atlanto-occipital membrane is attached to its posterior margin. The lateral margins, they provide attachment to alar ligaments. The structures passing through its anterior part are the apical ligament of Dens, the superior longitudinal band of cruciform ligament and membrana tectoria. And in the posterior part, we have the medulla oblongata, the meninges, the meningeal branch of upper cervical nerves, vertebral arteries, sympathetic plexus around the vertebral arteries, and anterior and posterior spinal arteries and spinal root of accessory nerve. So to remember the most important structures passing through this foramen, you can remember the mnemonic magical magma volcano always pours smoke. So we have the medulla oblongata, the meninges, as well as the meningeal branches of upper cervical nerves, the vertebral arteries here, and the anterior spinal artery, posterior spinal artery, and spinal root of accessory nerve, as well as the sympathetic plexus around vertebral arteries. The mastoid foramen is located just behind the mastoid process It transmits the emissary vein and meningeal branch of occipital artery. So to remember, you can remember the mnemonic Eager Vikings March. That is for emissary vein and the meningeal branch of occipital artery. And that wraps our journey through the foramina seen in the interior of skull. These tiny openings may seem small, but they play a huge role in neuroanatomy and in clinical practice. Focus on their locations, what passes through them, and the clinical relevance. It will make all the difference. If you found this video helpful, hit like, subscribe, and turn on notifications for more anatomy insights. Have any questions? Drop them in the comments. See you in the next one.